Hello. There's been some questions about the need for gastrografin on CT scan, and I want to sort of make that point here. So, in normal cases, when patients have a CT scan and they drink contrast, the contrast will go down from the esophagus down to the stomach, and it will go down all the way the path of the small bowel from stomach into the colon. Now, in a duodenal switch patient, and I want to make the point that this is for the duodenal switch, the real duodenal switch, and not the saline or the SIPS, because that's a different anatomy with different physiology. I didn't sort of draw the variation on the stomach here, but let's follow the contrast. What happens when a patient drinks a contrast with a CT scan in a CT scan with a gastrograph in contrast. So the contrast will go down the esophagus, stomach, and will go down alimentary limb and only the common channel. Note the distinction that there will not be any contrast in the biliary limb, and I'm going to draw that as the green channel where it mixes towards the end. So here's what happens when you have an obstruction, why it is critical when a patient shows up with abdominal pain, nausea, with or without vomiting, and they have had history of duodenal switch or in fact the gastric bypass, to have a CT scan with oral contrast, which should be gastrographin. And that'll be important to appreciate that. So when we look at this, what happens is, let's now go to a blank anatomy. And let's say there's a patient here that has some sort of an obstruction, all right? And that obstruction may be a tumor, a adhesion band, internal hernia where the bowel is twisted by itself, and so forth. So when a patient with a normal anatomy has some sort of a blockage, when they have the contrast will go down the stomach, esophagus. It will sit there, dilate, and since it can't go anywhere, the x-ray will be fairly clear, and this patient will have a significant nausea and vomiting, projectile vomiting through the mouth. When a patient has some sort of an obstruction of the alimentary limb, similar to what they had in a normal anatomy example, the same outcome will happen. The contrast will come down, sit in the stomach, not pass down the obstruction of the alimentary limb, and the patient will eventually have nausea and vomiting, and the contrast will go up. The problem happens is when the patient has an obstruction of the biliary limb or the common channel. So I'm going to go ahead and remove this obstruction. And let's see what happens when the contrast, when the contrast goes down. In the case of an alimentary limb, the contrast will go down all the way, and it will go down and not get past the common channel. Some of it may backflow into the alimentary limb, and actually I should have removed this one too, to make the point that we're assuming the blockage is only on the common channel, and this patient may or may not have an episode of nausea and vomiting. More likely than not, they will at some point have vomiting. Now, let me go back on this and erase that whole thing and show what happens when the patient has obstruction of the biliary limb. So let's say I have a blockage here. I will have the contrast, which will go down. It goes down all the way, but I'm continuously blocked and nauseous. So in this case, what I have is then I have elevated liver function test, nausea, but no vomiting. And that's the hallmark of this. If you just get a CT scan with no oral contrast, we will not be able to distinguish between the biliary limb or the alimentary limb. And in the CT scan, you will see a loop of dilated bowel, but you can't tell if it's the alimentary limb or the biliopancreatic limb. And the assumption would be, well, why don't we put a nasogastric tube in? Why don't we put a nasogastric tube in and suction this through the nose and hope that it gets better? Well, as you can see in this cartoon, there's nothing I can do in the blue line to decompress the green line. The only way to address a blockage of the biliary limb is surgery. And that can affect anywhere along this entire limb. Thank you.